Well, hello there, and welcome to our Health Professions Advising App Prep Workshop, all about the Casper, Cura, and AAMC preview tests. I'm Jenny, and I'm an advisor here at Health Professions. So glad you're here today. Hopefully, you're getting a chance to watch this recording on our YouTube channel. A little run through of what we're going to cover today. I'm always so proud to introduce our office, so I'll talk a little bit about who we are here at Health Professions Advising, introduce you to my colleagues and the services we provide. Then we'll jump right into a history of ethics in the health professions, and we'll talk about how you make ethical decisions in general, and then jump into situational judgment tests like the Casper Preview Cura. And then I'll throw in Duet because that comes for free with the Casper. So, hi there. We're Health Professions Advising. We're so proud to serve you. If you're UC Davis undergraduates, graduates, or alumni, we're here for you if you're headed for a health profession or an allied health field. We see you as whole people, and we take a competency-based approach to encouraging you to be proactive in the pursuit of your academic enrichment and your co-curricular engagement, and always encouraging you to be self-reflective. Physically, we're located down the road from Student Health and Counseling, across the street from the ARC, but not quite to the domes. We're all trained to answer your questions and support you um, in your preparation to be a health professional. Um, but we all have different perspectives and skills that we bring to the table. So I hope you'll have a chance to meet me and a number of my colleagues. And I couldn't stop there. I, of course, want to mention our professional student staff. These students are just a wee step ahead of where you are as applicants. They are admitted to their health professional schools, whether that's as vet students, nursing students, or medical school students. So, really valuable perspectives they can bring and help you help guide your path. I want to give a shout out to our peer advisors. They're always ready to answer your questions about choosing prerequisites, gap year plans, and they have a student's eye view of the experience here at UC Davis. From from shortest to longest, these are our advising services. So of course, we're health professions advising. This is our main thing. Give us a call for express advising, Monday through Thursday, 10 to 5, and Friday, 10 to 2. Then we also have drop-in advising. That's in the middle of the day, in the middle of the week. So Tuesday, 10 to 12, Wednesday, 11 to 1, and Thursday, 1 to 3. You can book an appointment starting at 8 a.m. on the same day. So come on in for a 15-minute one-on-one Zoom appointment. Then we have scheduled appointments. Those are 30-minute appointments. And those you book online as well. They book up about 3 weeks in advance, and all your questions and topics are welcome. Besides our advising, we have lots of programming. So you're at some of our programming now. This is our app prep series. We're known for our workshops, such as guest speaking for student orgs or health professional panels, or bringing in admissions reps. So I hope that you're following us on Instagram and following our newsletter to know what we're up to. We also offer longer programs. So like our test prep programming. We'll be having interview week coming up in September. We just wrapped up our spring break road trip, 36 schools in just 4 days. And look for us this summer at our spring break boot camps, or our summer boot camps, sorry. And then we have some bigger events that you might have attended, but I certainly want to invite you to attend, like our pre-health conference, largest in the nation, all student run, very proud. You, I'd like to invite you, if you're a pre-vet student, to our pre-vet symposium. We also host the Aspiring Black Physicians Conference. We host first year and transfer student orientations during orientation week in the fall. And we even outreach to high schoolers at our high school symposium. So let's dive in now to ethical decision making. For frame of reference, the Hippocratic Oath was written in the 5th century, and it often marks the entry into the medical profession. I've been to the white coat ceremony of the UC Davis School of Medicine, and they have the Hippocratic Oath read by admitted students in their ancestral languages. It's really, really moving to be in the room when that happens. In 1803, Thomas Percival, an English physician and philosopher, published a code of medical ethics describing professional duties and ideal behavior to hospitals and other charities. And then our own American Medical Association met for the first time in Philadelphia in 1847. And the two top items on the agenda were establishing a code of ethics and enumerating the minimum requirements for medical education and training. You might be interested to know that that document keeps evolving, and in 2001, it was updated to include physicians should support access to medical care for all people. Each of your professions is going to have a different ethical code, and I encourage you to take a look. This would be a good way to start getting your mind around um, taking some of these ethical tests or assessments. So you've done this surely already, but I just want to highlight the steps in making an ethical decision. First, you want to identify the problem or dilemma. Why is the assessment or why is your school asking this question? What are the values here that are trading off against each other? Is it first do no harm? Is it fairness and justice? Is it that people have the right to make their own decisions? What are the dynamics in play in the question? Identify all the potential issues involved. What could happen? Check out your relevant ethics codes and laws and regulations. No matter where you're working in the health professions, there will be an ethical board at your institution. You'll also be part of a professional organization that will have resources for you. Then you can obtain consultation wherever you're working by people who are used to navigating these decisions and are your supervisors or resources your supervisors would point you to. Consider the possible courses of action and then list out what could happen as a result of these different courses of action. Finally, choose what appears to be the best course of action. Finally, make a decision. So this is a bit of a formal outline, but I just want to say you all are trusted individuals. You hold responsibility in your student-run clinics, in your lab, in your family, in your classroom, in the community. You've been trusted to make decisions. You are already ethical people. So I'm just outlining things that you probably do intuitively so you could sort of study your own process as a way of preparing for these assessments. Before I dive into the assessments, I want to talk for a minute about multiple mini interviews. These are a type of interview that you might experience. And these are the steps to answering the question in a multiple mini interview. First, you'll receive a question, probably written, and you'll have a couple minutes to think about it. Then you'll pop into a space where steps before. And then bring in some stories from your own life. So, for example, you might be asked about how to allocate an organ between two possible patients. Of course, you haven't had that experience yet at this stage of your career. At least I don't think so. Um, but you might have been, for example, a resident advisor in your dormitory, and you might have had to allocate limited resources, um, budget resources to different events that you wanted to do. And you had to work that through with your colleagues and giving careful consideration to the people you serve. So that's an example of bringing in an example from your life that shows you in action working the question. Finally, highlight the relevance for your future career. So you can set up your conclusion by saying something like, I recognize that when I am in your school, or I recognize that when I am in this profession, I'm going to face these kind of questions. Reiterate the question that you just worked through and hit some concluding points about how you solved that problem. This is the little setup to your conclusion that lets them picture you in their school solving problems for their clients. Um, so what are situational judgment tests? Situational judgment tests are a type of psychological assessment that present you, the test taker, with realistic hypothetical scenarios that might ask you, what would you do in a dilemma and why would you do it that way? The assessments are not on non-academic attributes, so like your people skills and your approach to diversity. They will help determine your behavioral tendencies, and they can predict your future people skills performance. So examples of these tests are ones we're going to cover today: Casper, Kira, and the AAMC preview. First, let's take a break here. I know that I just said the word test, but this is not a test. Calm down. This is a formality. You might see overpriced and unethical sources of online support for these tests, but don't pay for that. Those sources of support are a scam. You're already an ethical person. You might need to do a little practice to prepare for the exam, but to prepare for the situational judgments test. But the preparation materials you need are offered through the test itself. You got this. So let's jump into talking about what the Casper is. The Casper stands for Computer-Based Assessment for Sampling Personal Characteristics. It's a situational judgment test that gives you a tough situation and asks what you would do and why. It helps determine your behavioral tendency, and it's especially nice and helpful for admissions committees who are trying to get a sense of how you'll perform in a people-centered profession. So it might help them get a read on your social intelligence, how you collaborate, communicate, empathize with your clients or colleagues. It might give your admissions committee a sense of your ethics or motivation, problem solving, professionalism, or even your resilience. To take the Casper, go ahead and register online. That registration is going to open in late March, but plan to get it done on the sooner side. Plan to take it by July. The fee this year is $85, and that includes distribution to 8 schools. If you're applying to more than 8 schools, then there will be $15 additional charge per distribution after 8. Your payment for the Casper includes the Duet, which we're going to talk about in a minute, and your fee assistance program will be honored. Accommodations do take a minute to process, so request those 3 weeks before the test date. Distribution will go out 2 to 3 weeks after the test date and are good for 1 cycle. So again, go ahead and be on the early side for this. Like I said, you've got it. You've been making decisions all along. People trust you. You know who you are and you know your values. Just to go a little deeper into what the Casper is, or actually sort of how to do the Casper. First, verify your account online. Set up your test date and time. Big pro tip. Know the time zone. We can't tell you the number of panicked people we've talked to who missed their test time because the time zone was not Pacific. So make sure that you know what time what your time your Casper is going to be, and watch out for your Google Calendar thinking it's smarter than you and putting your test on the calendar at a funny time. Double check and know it in your own head. Um, I recommend that you log in and complete a system check before the day of the test and try out what does the format look like. Do a couple of the practice questions just so your day flows smoothly when you're in it. You've been doing things on Zoom for a while now, so I don't need to tell you, find a quiet place to take the test. Make sure you look good. No jammies, please. And make sure that you have the right equipment. Um, there will be more test tips for video responses in the practice. What will you see when you're in the Casper? You'll see 14 scenarios, real world situations with an ethical dilemma. There will be two different kinds of scenarios. So sometimes they'll be word-based or video-based. And there will be two different types of responses you might give. Sometimes you might give a video response, or sometimes you might type your response. The whole test is a little bit shorter this year. It's 90 to 110 minutes. And you'll be interested to know that it's scored by human raters. When you're taking the Casper, be sure to read all the questions fully and plan your response. If I was going to give you a pro tip here, it would be to prep the prep. So in that time that you're allowed to plan your response, see if you can get a little bit of an outline put together that repeats the question, answers the question directly, brings in an example from your experience, and exits by saying, when I am in your program or when I am in your profession, this is how I will solve these kinds of ethical dilemmas. Make sure you do respond to all the questions, and don't worry if you don't finish a thought or a scenario. Take the full time to respond, because the longer you're talking, the more they get an impression of you. And here is a link to some of the samples. You'll find those quite readily on the Casper page. So remember, I was saying the Casper was rated by real people. So it's rated similarly to a multiple mini interview. Each section is actually scored by a unique rater. There might be 14 independent raters who see each response. So that allows many people to have an independent impression of you. The raters are trained to ignore little mistakes like spelling or grammar, so don't worry. Just be yourself. Scoring is based on the content of how you solve a problem and the justification and your sense of ethics. So there's no right or wrong answer. And in fact, thinking that there is a right or wrong answer is kind of a flaw. The challenge with ethical dilemmas is always that the ethics you're pursuing compete and to override and trade off against each other. That's what makes ethical decisions challenging. So your raters really just want to see you work your way through a tough problem. Quick note to cover the duet. The duet is a values-based alignment that helps to schools to understand if you fit with them and help you understand if you fit with them. So it compares your values to what a program has to offer. You'll notice that it has 3 categories and 7 characteristics. So you'll make 10 choices to reflect on and suggest and select one category that's most important to you. So it's essentially a ranking tool. Just want to say, I think I did these kind of things like on the bus or at sleepovers when I was a kid. It's your self-awareness is valuable here, but there's no right or wrong answer. It's really just a sense of what matters to you in your profession, and that helps you notice your alignment with the mission statement of the schools you might be applying to. The duet's not timed, but it will take about 15 minutes and it'll get sent out within 14 days of Casper. Oh, do take it within 14 days of Casper so that they can send your results together. We've talked a little bit about how the duet works. You'll note when you're in it, you'll see that there's an introduction. You'll get a chance to reflect and read the definition of 7 characteristics. And then you'll make 21 comparisons for each of 3 categories. And each comparison has 10 choices. You'll just keep going until all the questions are complete, and hit submit. There's no practice for Duet, and there's no practice component provided by the testing company. So you'll just read instructions when you enter Duet. Make sure, of course, to read them carefully. You'll be presented with characteristics and their definitions. So there again, read nice and slowly to familiar yourself with those definitions before proceeding onto the comparison page. Pro tip, go with your gut, no right or wrong answer here. All right, moving on to the preview. This is a situational judgment test put out by the American Association of Medical Colleges. It will toss you a series of hypothetical scenarios that students might encounter in medical school, and it asks you to evaluate the effectiveness of a series of behavioral responses to a scenario. So they'll give you a scenario and ask you, would you do A, B, C, or D? You'll register for the preview in your AAMC account. There's a $100 flat fee, and your fee assistance program will be honored, as will your accommodations. The test dates are March to October, but again, go ahead and take this on on the early side. You're not going to get more ethical in the short term. You've been building your values and your way of solving problems all along. How does the preview work? It's 75 minutes online. You'll see 30 scenario sets. And here again, you'll have a live remote human proctor. It takes about 30 days to receive your scores. And it's an AAMC assessment, so it doesn't apply to other health professional fields, just people who are applying to allopathic schools. I don't know how familiar you are with the core competencies, but hopefully pretty familiar if you've been working with us here at Health Professions Advising. There are more core competencies than this, but these are the ones that are highlighted in the AAMC preview. So service orientation, social skills, cultural competence, teamwork, ethical responsibility to self and others, resilience and adaptability, reliability and dependability, and capacity for improvement. The preview format is such that scenarios are presented that present a hypothetical dilemma are similar to what you might encounter in medical school. They don't assume that you have had any experience in medical school. These are the sort of scenarios and dilemmas that you'll be confident working your way through. You'll rate the effectiveness of several different behaviors and describe a response to the dilemma presented in the scenario. Like I said before, there's 30 scenarios. You can see plenty of samples in the test day experience and booklet. So I really recommend that you take a look at those before you do the preview for real. So remember I was saying there you'll get 4 different behavioral options. You've probably encountered this in real life. Sometimes what you choose to do in the face of a dilemma is very effective, and your response will significantly improve the situation. On the other hand, sometimes you will choose a behavior that's very ineffective. I know I've done it. Responses that cause additional problems and make the situation worse. And then in the middle zone, you might you'll notice that one of the answers could be effective. It could help, but not significantly improve the situation, or ineffective, a response that won't improve the situation or might cause a problem. So again, you've been out in the community, you've been here in school, you've you worked with people before, you've been in positions of responsibility and trust. You've been trusted to make decisions. The preview is just asking you to show someone how you make ethical decisions. Finally, the Kira. The Kira is really similar to a multiple mini interview. So remember, we talked about that early on in this presentation. The Kira can give you two types of assessment, either asynchronous or live interview. If you're doing the asynchronous Kira, that'll be a one-way interview such that you submit a timed video or written response to questions that are pre-recorded by your school. They're just there, you'll have a designated prep and response time. So remember, prep the prep. If you're going to practice for this at all, look up some standard questions and prep the experience of getting your thoughts together in that little bit of prep time. If you're doing the Kira as a live interview, then it'll be a live interview, two-way, and you'll be connected with a live interviewer and moved automatically from station to station. If you're looking to prep for the Kira, I recommend that you look at a standard bank. You can find many online of MMI questions. You can practice some of the common questions so that you have your thoughts together on the day. Be yourself. Um, I'm not going to go too deeply into the setup. You've been using Zoom for a while, but just the basics. Check your software, disable extensions. And have your laptop or desktop and all the accessories like your camera, microphone, speakers, and stable internet. Tablets and smartphones are not likely to work well for Kira. As usual, dress for success and make sure your lighting's good so they can see your face, and of course, a quiet place. Um, Allow about 30 minutes for the check-in process with Kira. And my pro tip to you is check out those samples online so you get a feel of what the day is going to be like. Just a quick review of the multiple mini interviews and how you answer a Kira question. Summarize what you just read. Do answer the question, very important. Bring in an example from your real life and exit by saying, I recognize that when I'm in your program, I'm going to face this kind of dilemma, and you can trust me to approach it this way. I'd like to warmly invite you to our interview week coming up in September, date TBD, um, to practice for multiple mini interviews. All right, so that's us for today. Stay connected, subscribe to our newsletter, and follow us on Instagram so you know all the ways to be growing your identity as a pre-health student here at Davis. We'd love to hear from you all the ways, so drop by, call, check out our webpage, or make an advising appointment. We're here for you. Thanks for being here today, everybody, and good luck on those situational judgment tests.